The wraparound movement began in the 1980s in response to the lack of effective community options for providing intensive supports to youth with complex behavioral health needs and their families. Over time, wraparound has become a well-defined and research-based care coordination practice model. Wraparound also serves as a system intervention that supports behavioral health reform at the state, local, and program levels. At the state level, wraparound works to hold states accountable for ensuring that an array of evidence-based clinical services and non-traditional supports are in place. Wraparound initiatives also promote workforce development, access to peer supports, quality assurance, and outcomes monitoring. All these activities together aim to ensure that costs are reduced, and also that youth and families have access to high-quality, community-based care that meets their individualized needs. At the local or program level, wraparound requires that providers collaborate to serve a population of youth whose needs exceed the resources and the expertise of any one organization or child-serving system. To do this, providers must extend their perspective beyond the walls of their own organizations and work together to do whatever it takes to ensure youth with behavioral health challenges and their families live and thrive in their homes, communities, and schools. At the youth and family level, wraparound is unlike traditional services in that it is a team-based care planning process in which formal and informal supports partner authentically to address the root causes of the challenges faced by families. The wraparound care coordinator works with the young person and their family to convene a team of friends, neighbors, and community members, as well as service providers and other supports, to develop a comprehensive, individualized, and creative plan of care. This is not your traditional plan of care. The care coordinator works to support system partners to be flexible in expectations and pushes service providers beyond their traditional roles. Informal supports take on key strategies in the plan of care, further supporting the family in meaningful and enduring ways. The wraparound team then collaborates to implement the plan, monitor progress, and revise as necessary. There is now strong evidence that when wraparound is done well, or with fidelity, young people are more likely to stay in their communities and to experience improved mental health and better functioning across life domains. Extensive evaluation data also now show that all of this effort typically saves money by minimizing the time young people spend in out-of-home facilities like residential treatment centers or hospitals. Wraparound is growing in its adoption nationally, but states and organizations still struggle in moving beyond a value base and toward high-quality practices and care planning. The National Wraparound Initiative and the National Wraparound Implementation Center have gathered many resources and tools to ensure that this work is done well across all levels of effort, so that wraparound programs will achieve the positive outcomes that have been demonstrated in states across the country. We encourage you to look at these materials or to visit our websites to learn more.